Westbrook Health Services has been supporting the surrounding community since 1949 and is known as an agency that is community-focused, people-driven. As one of West Virginia's 13 comprehensive behavioral health centers, Westbrook provides services to 8 counties throughout the Mountaineer State and became one of the first comprehensive community behavioral health clinics in West Virginia in 2020. This podcast wouldn't be possible without the generous help of the Sisters Health Foundation. This year marks 25 years since the foundation awarded its first grant, and we couldn't be more grateful for their support. Welcome to Studio 2121.
Welcome to this episode of Studio 2121. I'm Jason Fairby. I'm the Adult Intervention Specialist here at Westbrook Health Services in Prevent Suicide, West Virginia. Today we have with us Barry Fawcett, the Director of Prevent Suicide, West Virginia, and Chelsea Rose.
I'm the Marketing Coordinator here at Westbrook.
Okay.
And I do a lot of work with Prevent Suicide as well.
Awesome. Barry, tell us a little bit about yourself.
Again, I'm the Director of Prevent Suicide West Virginia. I am the mother of 3 beautiful boys, 21, 17, and 16. I've been doing this for about 13 years. Prior to that, I was a therapist at an intensive outpatient program at an alternative middle school, which was challenging but rewarding, and I absolutely love what I do. It is a passion beyond profession.
Oh, great. Chelsea?
I grew up in Colorado. I grew up in the outdoors, love for hunting and hiking and camping and everything else, and then I ended up relocating to West Virginia about 6 years ago, and I've never felt more at home. I love the people here. I love my place here. I just feel so welcomed, and it's a good place to call home. I have a 2-year-old beautiful daughter that I'm raising, and she's just as outdoorsy as I am. She's happier outdoors than she is in, but and here at Westbrook, I found a family. Since the day I started at Westbrook, I felt like it was my place to be, and I'm very excited to, continue this journey through Westbrook. So,
awesome. I'm from here in Parkersburg. Born and raised. I've lived here most of my life. I've lived out a few times. I was in the restaurant business for about 20 years. The last part of that, I was doing suicide prevention, volunteer work, advocacy work, and then found a home at Westbrook as well, and I feel it's certainly family. So we want to talk a little bit about what Prevent Suicide West Virginia does.
So we are the state suicide prevention program comprised of approximately 12 individuals who are funded through SAMHSA for youth as well as SAMHSA for adult, but under different grants. So Garrett Lee Smith Memorial Grant funds the youth intervention specialist, and the state opioid response grant funds the adults. Essentially, we're charged with prevention, intervention, and unfortunately sometimes postvention throughout the state. But regionally, we're divided in 6 regions, and there's 2 intervention specialists per region that do the work. That includes training, technical assistance, and consultation. The most important charge, I think, that we have, that we continue to work on, is providing for continuity of care for individuals who have lived experience with suicide, those who are attempt survivors, and then again, support survivors of suicide loss as well.
Okay. Great. I have a parody, I guess, of the recovery community and suicide prevention work. I just celebrated 12 years sober.
Congratulations.
Last week, which is initially what brought me to what opened the door to Westbrook for me as a peer recovery specialist, and working with the QRT team, which is the quick response team, doing overdose wellness checks, and from there I moved into the youth intervention specialist position, going into schools and working with the youth, and then now I'm the adult intervention specialist, but I still do work with the QRT teams and under the opioid grant. So it's kind of a little of both. Sometimes the two go hand in hand.
Absolutely. And I think something I want to point out as well is that we do have the opportunity to touch a lot of individuals, and we can't really quantify, or we do quantify, but can't necessarily understand the qualitative impact that we have. But, in the last 5 years, through your work as a youth intervention specialist, as well as our other individuals, we have trained over 100,000 individuals, which I think is pretty important, because I really truly believe that this is a grassroots efforts initiative in order to prevent suicides in West Virginia.
Absolutely. I know that next month is Mental Health Awareness Month, so that's a really big month for Prevent Suicide West Virginia. Do you have anything coming up, or any sort of events or anything?
Absolutely. So the week of May 1st through 7th is called Children's Mental Health Acceptance Week, which I don't agree with, because it's really awareness. I mean, acceptance to me feels like we're putting stigma back on mental health. But during that week, we are encouraging our intervention specialists to do sidewalk campaigns or go into schools and You Matter campaigns, etc. We're going to do some social media stuff. And then the following week is SAMHSA's Prevention Week, of which May 11th is Suicide Prevention Day. And I actually am going to be providing for applied suicide intervention skills training in Elkins on that day, but encourage our intervention specialists to do something to memorialize, honor that day. Additionally, there is a plan to do an honoring of those we lost to suicide in 2020 later in the month. So the venue is yet to be determined, so I don't want to announce that yet. But I will acknowledge that in West Virginia in 2020, we lost 354 individuals to suicide. And one is too many. One is someone. So we definitely want to honor those losses.
Here locally on May 11th, we're going to be at the city park providing support for a local lady that has lost her son to suicide. Christopher's Cause, I believe, is the title of the event. It's going to be music at the band shell from 11 a.m. to I think roughly 6. So we'll have some resource tables set up there, and it'll be a place for people to gather.
Great.
And talk about their experiences and share with one another, and just feel comfortable and feel welcomed.
And that's such meaningful work, because it just providing for an opportunity to have a safe and meaningful conversation about suicide where someone might not anticipate it is such a big thing of what we do. Recently, and you were there as well, we were at the state basketball tournaments, and just to allow individuals to have resources and to be able to talk about their experiences with suicide and decrease that stigma associated and feel accepted for being who they are, I think is really an important part of what we do.
Yeah, absolutely. Anytime I wear a shirt or a jacket or anything that shows the work that I do, people open up and talk to me. They realize that I'm somebody that's safe to talk to. Sometimes I tell my story, not always. I lost my dad to suicide in 1994. I was 20 years old. In 2007, I lost one of my best friends. So it has touched my life a lot more than I wish it had, but it's brought me here, and I'm doing good things, I feel, with those experiences.
Yeah. Doing something good with your something terrible.
Right.
I feel like in our field, we all have purpose. We're all here to work and make a living, but it's more than that. We're here to provide, that safe space for others, because, we have purpose and we have reason. And I know that, your father passed away, and my father recently passed away from suicide as well in September. So I'd say that is my purpose and my reason. I know that it's something bigger than I am, and I'm just a part of the puzzle and part of it, to provide that for people and to bring awareness, especially on the social media marketing aspect of it. I'm trying as hard as I can to be able to do that for people. So there is a safe space, regardless of, your situation or your circumstance. We can always rise and come out of it a little better.
Right.
And I think it's hard to understand that if you've not been there. I personally have not been in that unbearable psychological pain, but respect it entirely, because oftentimes individuals with lived experience who've shared their story with me let me know that they just wanted a way out. For example, it's been explained to me before, an individual said, I felt like I was on fire and I just wanted to put it out. And I can't imagine that the pain and just that illogical reasoning at that moment, but in their mind, logical to just escape the pain. So, as I've done this work over the course of the last decade, I do respect where people are in their despair, and acknowledge that suicide is a death of despair, and but never will give up in trying to prevent such a death, and giving people hope, and giving people the opportunity to speak about it, and hopefully help save lives.
Sure. Our experience too is valuable for others that share our experience, and suicide can touch people in a lot different ways. We lost our fathers. I lost a friend. People that lose siblings, it feels a little bit different. People that lose children feels a little bit different. And making spouses, making those connections to those people that have that same experience is great for support as well. It's like the recovery community, when people understand and know what you've gone through because they've gone through it also. There's a relationship there that allows you to heal, and get support when we all share the same feelings.
You kind of have that sense of empathy,
And I think that's part of our work, is connecting people. Connectedness is the number one protective factor against suicide. And again, I don't know where you've been in regards to not only recovery, but as well as the loss of your fathers. But again, respect and want to connect you with someone who can meet you where you are for survivor support, for, understanding and empathy and all of those things. The one thing I will say as a result of my job, and I say it often, but I do take a irrational responsibility for the loss, and I know you guys probably do that as well. When we lose somebody in your community, you think, what could we have done? And all I know is that when we know better, we do better. So that's, what we try to do every day. Educate people on what to look for, how to respond, how to react to individuals who are in suicidal crisis, and hopefully increase the infrastructure in agencies like Westbrook and, all the comprehensive behavioral health services to do better in responding to people who are at risk.
Do you think that, for some of our listeners and viewers, that you could go through some of those signs and what to look for and how to respond a little bit?
Absolutely. So suicide is super complex and multifaceted. So there's not just a couple of signs that might be an individual at risk, because it could be anything. But if someone's isolating, withdrawing, increased substance misuse, pulling away from friends, feeling trapped, anxious, hopeless, helpless, those can be signs that someone's thinking about suicide. And the best thing to do is acknowledge that you notice such signs and then ask clearly and directly about suicide. It's a 7-letter word that's unmentionable in our communities, but continues to occur. So say, I've noticed you're pulling away from friends, you're not, showing up for work for time, you're not taking care of yourself as you normally are. Are you thinking about suicide? That's the best way to say it, is to ask clearly and directly, because then that allows that individual to say, yes, and it's okay to have this conversation.
Right. I liked your phrase of meeting people where they are. With kids, it's important that we do the same, and where they are on social media, on Snapchat, things like that. A lot of their communication comes in the form of, something digital opposed to in person like it was, I guess when I was younger. So if your friends are, if you're younger and your friends are not texting you back, or, they've gone off Snapchat, or they haven't posted anything for a while, that could be something that they're going through, which it may not, they may not be struggling to the point of, contemplating suicide, but they're also hurting a little bit. It could mean that it's a good reason to reach out and just check on one another.
Well, and if it's not about suicide, at least you show that you care, that I noticed something's going on.
Sure. Yeah.
And then you also, by asking that question, and if it's not about suicide, you've allowed that to be a conversation if it needs to be in the future. Like, okay, no, not right now, it's not about suicide, but I know it's okay to talk to them about it now because they've been clear and direct and asked me the question. So, it really is important to allow for a safe and meaningful conversation. And additionally, as a parent, I think it's important to not make it about you, but about your child. So it's not like, oh my gosh, you can't do this to us. What is this about? You need to be like, okay, if this is what it is, I'm in here with you and we'll figure it out.
Right.
So being accepting and not judgmental about whatever the answer is, I think is super important.
Sure. So everybody has mental health, right? Be it good or whatever average means, or bad mental health, poor mental health, where people are struggling. So even these conversations in good times, if you will, are important to keep that conversation flowing, to keep that communication open.
And I think it's important to know when you need help outside of yourself. So I'll be totally honest in regards to COVID and anxiety. I had probably medium level anxiety, and when COVID came, it increased, as did, according to research and everything else, a lot of people had increased anxiety. And it got a little bit irrational, where I would think of silly things like, oh gosh, I'm in a parking lot and there's a car and it's going to like crush my legs. And that seems irrational, but I knew that was outside of my control as much as I tried to control it myself. So, I go and get help when you need it. And I encourage everybody to get help outside of yourself when you need it, because sometimes things are just bigger than us, and that's okay. But there's help out there that you can get, and then it can be within your control.
And I think the other thing to note too is that those resources, the people that are on the other side of those resources are there to help. They're not judgmental. They know that you have some issues that you're wanting to, bring to the surface, and they are ready to be there and provide you with everything that you need in order to accomplish that, So you're not going to be judged. You're not going to be, looked over. It's, we're here to help in any capacity, possible.
And it takes strength and courage to reach out for help. It is not a weakness.
Absolutely.
It is a strength.
So a couple questions I ask in some of the groups that I facilitate with Smart Recovery and other instances that we find ourselves in, I ask everybody by a show of hands who likes to ask for help. And rarely does anybody ever raise their hand. And then I say, okay, who here likes to help others? When they ask, raise your hand. And almost always everybody raises their hand. And I say, well, how are these two things going on in every room I go into and with everybody I talk to? Nobody likes to ask for help, but everybody likes to help. So knowing that, most everybody likes to help should give us a little bit of comfort, and knowing that it's okay to make a reach. But it's not difficult, or it is difficult. I'm sorry,
And I think we need to equate mental health with medical health, or physical health. For example, if you break your arm, you're going to go to the emergency room or MedExpress, whatever, and get it repaired. So if something's broken in your head or heart, it should just be a natural reaction to go and get it repaired and get some help for it. So we're not at that place yet, but we need to get there, because the brain is an organ in your body.
Normalize these conversations of what do I do when I feel this way.
That's right.
And I think if we've benefited from anything with COVID, that is a big part of it, is that this conversation is starting to get normalized.
Yes, we've elevated the conversation regarding mental health.
Absolutely. Would you guys care to share, any of the resources that are available to people that might be contemplating suicide?
Sure. So there is the National Suicide Prevention Lifeline, 1-800-273-8255. There's a crisis text line, 741-741. There's a wide array of websites on preventsuicidewv.com. Additionally, there's the Suicide Prevention Resource Center, so there's a lot of information out there, but again, you just have to reach out and ask for the help.
And Westbrook does have our crisis line number. That somebody answers 24 hours a day. Also, a lot of people, I'm not sure, locally don't know that you can just come to Westbrook on 7th Street, East 7th Street. Come straight to the front door when you need a little bit of help.
And the Bureau for Behavioral Health also sponsors the Help for WV, where you can call to get treatment services within your area. They also have a 304 line and a crisis line for children. So those are some other resources to reach out and get some links to help.
And something that's been in the works for a while, which will come to fruition later this year, is 988.
July 16th, 2022.
Okay, so we're coming right up. So that will be a number that you're able to call for a mental health emergency.
And that is a step in that right direction of the parity between medical and mental health. And the idea behind 988 is not only to increase the infrastructure for response to Lifeline, short term, But the longer term goal is to increase a crisis response system. So mobile crisis response, which Westbrook has some of that already, as well as maybe a mental health med express where people can go when they're in crisis versus a emergency department. So there's a lot of other things in the works.
It's streamlining the certain services that you need instead of trying to go to the same place or to the same number for certain things. I think a misconception is people think if you call 988 that they're immediately going to roll an ambulance, and law enforcement out to to your location, and that is simply not the case. The idea is to have the resources available, to have a plan in place to set treatment or care over the phone, so less ambulances roll out for those situations.
And 80% of individuals who call the Lifeline currently, the crisis gets resolved during the conversation. So there's a very little amount of individuals that would need further assistance outside of that call. So oftentimes people just want to be heard. They need to establish some kind of plan for safety for now, and then the crisis can be resolved. So that's important to acknowledge as well.
Yeah. I know Westbrook is also helping with some training for local law enforcement and hopefully for the 911 center as well. There'll be mental health first aid training, de-escalation training, and safe talk, which we provide in the hopes of resolving those issues, over the phone instead of have to roll an EMT and law enforcement out.
Right. That's a last resort.
Sure.
Really. The idea is just to, be heard, create a plan for safety, and then follow up for treatment if necessary. But not everybody who's suicidal needs to go to a hospital. There's a tiered response level, and we're hoping to increase that ability within all the communities in West Virginia.
Sure. It also gives us an opportunity to support EMTs and law enforcement,
absolutely.
Because sometimes they're out there and then they encounter these situations, by themselves. And they can be better prepared, and we can be there to support them.
Yeah. In an idealistic world, everybody would be trained in suicide intervention, because suicide prevention is the responsibility of everyone. It's within the capability of anyone. So in an idealistic world, everybody would be trained in that. But the more that we can increase that, the better off we'll be.
I think it shows the importance of having these conversations on a regular basis, of not needing to wait for something to go wrong, for the trauma to occur, the emergency to occur, before we start talking about our mental health. And the more people that are trained, and the more schools that we go into, and we talk to kids, and we let them know, you don't have to have a reason to want to talk about your mental health. If you're feeling a certain way, reach out and talk to somebody. And as that gets more ingrained into the culture, I think it'll be safer for all of us.
And the more you have that conversation, the less uncomfortable it becomes.
Sure.
So initially it is a little bit scary, and you shake and, oh gosh, what are we going to get? But the more we become comfortable with it, the more we allow that conversation to occur, the more acceptable who you are is who you are. It's okay to not be okay. I know this is cliche, but it's not okay to stay there.
Yeah, absolutely.
In 1994, when I lost my dad, it was a topic that was just not talked about. We weren't told not to talk about it, but the feelings that came along with it. I carried a fair amount of shame for a while because I lost my dad, and there's just simply no reason. All these years later, I know there was no reason for me, to feel that way, but it was part of it. And people didn't really understand as much. I definitely would have needed people like us, at that time, which is one of the reasons, most of us do what we do.
Right.
Now is to provide that support. But we have came a long way. And even in the last 5 years, I think, we were working on 988 before we knew it was 988.
Right. You've been on Capitol Hill multiple times advocating for that number.
Right. Before we knew what it was going to be when we were there, so as these steps are taken, I think we're just providing better and better service for our community.
We've come a long way, but we've got a long way to go.
Yeah.
Well, I appreciate you coming out to talk with us today.
For sure.
Absolutely. I appreciate all the work that you're doing. It's, it's making a huge difference in our
It's a
community.
huge honor
Yeah.
to do so.
Absolutely. And thank you, Jason, for joining us.
Absolutely.
And thank you, Jason, for all the work you do, and you as well for your advocacy and your voice in elevating the platform on the discussion of suicide prevention.
Absolutely.
Together we're stronger.
Amen to that.